الرحمن الرحيم. هنبدأ الجلسة بتاعتنا إن شاء الله بتاعت الشيست ايميجينج. إن شاء الله أول سبيكر بروفيسور دكتور رانيا رأفت، أستاذ الأشعة التشخيصية. رانيا رفعت، أستاذ الأشعة التشخيصية بجامعة عين شمس. She will talk about ground breaking updates in artificial intelligence in thoracic imaging and تفضلي يا دكتورة رانيا.
First of all, I'd like to thank all the audience as well as our chairperson and Dr. Nihad Osman, because she is the female of the chair board. Also, I'd like to thank Dr. Muhammad Abul Huda, our godfather for this conference, and all organizing committee to get out our conference in this stage. I am delighted to announce my affiliation to Ain Shams University, Department of Diagnostic Radiology, Intervention and Molecular Imaging. I am proud to be one of the first consultants to build up the cornerstone of the AI chest imaging project in Department of Health, General Department of Health, with collaboration of Dr. Hala Mustafa, the General Manager of the department, as well as my best colleague ever, Dr. Muhammad Fauzi, the consultant of radiological affairs for MOH. First of all, the title of my lecture is The Groundbreaking Update of AI in Thoracic Imaging, Reshaping the Landscape of Diagnostic Thoracic Radiology. First of all, we would like to give a short note about why AI was innovated. Because of the shortage of the radiologist, which is a global phenomenon, not only in Egypt. This increases the workload and elevates the risk for burnout and errors. As well as all of this will adversely affecting the patient safety. AI, the aim of AI is to enhance the detection, to reduce the error, to improve the accuracy, and to reduce the time required to interpret images. The chest imaging, not only lung, it's heart, vascular, lung, thoracic diseases. There is a study, according to a study in 2019, the chronic respiratory diseases accounted for 445.6 million, and it's expecting to increase. The World Health Organization study showed that the lower respiratory infection is the sixth leading cause of death in 2030. And this increasing burden affected the total daily activity of the individual. AI first started with ML, which is machine learning, and then they upgraded it to the deep learning. Deep learning enabled the machine to learn more about the data we are getting it in the machine to get higher level of features to form it into structured data. It's similar to the ANN, which is the artificial neural network, to enhance the act of the machine. It utilizes a convolutional neural network to employ the deep learning, particularly, as we said, in the conventional neural network. The large language model, such as chat generative pre-trained transformer, is commonly used to generate the reports. First of all, the most challenge is how to identify the disease, and then we are going to separate the disease from a normal anatomy. The data is, this is called labeling the data. The algorithm then is trained, as we will see in the next image. Here we can see data collection. After data collection, we have to make something called data labeling, and then the algorithm is generated and is trained to act on the given images, and this is the software usage. The imaging, as imaging volumes increases, we need significant workload to be done in order to get diagnostic accuracy and timeless reporting. There is another important fact that thoracic imaging, in thoracic imaging, we are going to interpret chest X-ray, CT, and MRI, so it's not only chest X-ray. This is one of the algorithms used. It's depend on 3 categories: is disease identification, and then segmentation, and as we see, report generation. It starts with detection of the disease, which is consolidation, for example, or whatever the pathology, and then it's going to segment it, what is the percentage of the lung affection, and then the AI will make a report or generate a report. It generated into percentages. We are going to identify the anomaly, like this image, cardiomegaly, edema, blah, 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 and then it's going to make a percentage of each disease. And at the end, it will generate a report. In chest X-ray, AI was tested in pulmonary infection, pulmonary nodule, pneumothorax, and there is some other application we are going to discuss. In pulmonary infection, the main use is for emergency department physician who benefit from application of deep learning to make an accurate and rapid diagnosis for identification of any lesion detected in chest X-ray. It enhances the efficiency and the accuracy and reduce the diagnostic error. Also, it's one study was done testing what's called chat net achieved the performance level, which is comparable to an expert radiologist in detecting pneumonia. Here is one image showing the tele-tech algorithm for detection of pneumonia in the chest X-ray of an adult and in a child. A study was done in 2021 to evaluate different algorithms. It ended up that the performance in detection of active pulmonary tuberculosis surpassed that of the human readers, and with the decrease in the confirmatory assay of TB, which is called expert MTB RIF assay. Here is one image with chest X-ray without AI and with AI to detect patchy consolidation, which is poorly defined in the left lung, but here is with the AI detection of these nodules as well as consolidations. Another case with active TB. This is the image without AI, and here is image with application of AI showing the affection of the right upper lung zone with micronodules, and this case was confirmed to be active TB. So it significantly exceeded the observed performance with radiologist alone, and getting the enhancement of sensitivity, and this will reduce the workload for radiologists. For pulmonary nodules, it improved the diagnostic accuracy, especially in patients with newly visible metastases in cancer patients. Zhang et al. In 2020 able to detect easily missed nodules, and this reduces the false negative reports. Here we can see the chest X-ray, which will be confusing to any of us, and we can easily make it normal. Here we can see a faint nodule without AI application, and here is with AI application. It was an algorithm called InSight. AI for detection of pneumothorax, it significantly reduces the false negative rates, especially in cases with a small amount of pneumothorax. So it will help in monitoring the delayed onset of neurothorax, especially after percutaneous needle biopsies. And it will improve the management and monitoring of the patient with pneumothorax. Here we can see a case of chest X-ray. This area of pneumothorax can be missed easily. After application of AI, it's nicely demonstrating the area of pneumothorax, especially if a resident with little experience is going to interpret the chest X-ray. Other applications included the prognostic features of lung cancer, like pleural invasion or lymph nodal evaluation. This is the AI in chest X-ray, while AI in CT, it enables detection of lung nodule and cancer, and chronic obstructive pulmonary disease, interstitial lung disease, pulmonary embolism, and there is other application I'm going to mention. We will discuss each topic separately. For lung cancer, it enables not only nodule detection, but also characterization and measurement. Here we can see a lung nodule measurement. It's a ground glossing nodule. It enables detection and volumetric measurement of the lung nodule. Regarding the application in lung cancer, it improved the detection, and it was comparable or superior to the performance of radiologists alone in detecting pulmonary nodules. The main issue in lung cancer is to reduce the interpretation time needed to interpret the CT. Here we can see almost normal or near normal chest X-ray. We cannot identify abnormality except this one, and it's very difficult to detect. We can see it retrospectively. Here we can see a CT complementary. There is a nodule in the periphery of the right lung. After application of AI, it nicely showed this nodule. One nodule is in the periphery of the left lung, and the other one projecting over the heart, related to the base of the left lung. And it was metastatic. As we said, it's not only detection of the nodule, characterization also, and volumetric measurement. And this is the algorithm Lucas algorithm, which is commercially available algorithm for AI for pulmonary nodules. And it was capable for measurement of the size and the growth rate when we are comparing the volume. Hence, we can assess the treatment response in clinical settings. Radiomics of the lung nodules, as we will see in this next image. Here it can detect a ground glossing nodule with volume measurement and boundary assessment. It can estimate the growth rate, as we said, and it will improve the accuracy of malignancy risk. Regarding the prognosis in patients with lung cancer through detection of pleural invasion, lymph node, especially the mediastinal lymph node, lymphangitis carcinomatosis if it's present, and venous or perineural affection, as well as visceral pleural invasion in CT images. It shows promise in directly predicting disease-free and overall survival in patients with early stage of adenocarcinoma using the chest CT scan. Regarding the COPD, it's not only visual grading of the emphysema, whether centrilobular or paraseptal. It can detect it with quantitative measurement through assessment of the affected lung volume. This is done by the calculation of the percentage of the low attenuated areas, which is below 950 minus Hounsfield unit, and detection of the volume. For interstitial lung disease, it enhances the agreement, and hence it can help to predict the prognosis in patients with ILD through evaluation of the volumetric measurement and percentages of the affected areas of the lung. This is an algorithm belonging to Siemens Healthcare. It detects a case of lymphangiomyomatosis, and here we can see there is marking of all lung cysts, and here is calculation of the volume of the lung affected, how much the lung is affected. So it can be used also in ILD diseases for detection and lung segmentation of the affected areas of the lung through quantification, not only qualitative assessment. So it can be used to detect whether the disease is disease prognosis, whether it's progressed or regressed. The quantitative analysis will support the clinician in making treatment decision and improve the therapy to tailor it according to the individual patient needs. Here, case of COVID. Here we can see the affection of the area of consolidation in both lung lobes. And here is the marking of the most lobe affected. So it can help also in following the patient according to the treatment given. Application of pulmonary embolism, the main issue is to calculate the clot burden through volumetric measurement. Here we can see a case of the pulmonary embolism with multiple filling defect of the pulmonary arteries. And AI in aortic dissection can be used for screening, image segmentation, output come. Here we can see the dissection flap in the ascending aorta. Here is in descending aorta. And here is the application of Siemens software through measurement of the aorta in different locations to detect dilatation or any abnormality. It also in CT coronary through detection of the calcification and coronary artery stenosis. And in rib fracture, it can be done to detect the subtle fracture through some called unfolding view. Here we can see the ribs unfolded in order to be detected by AI. This is a case of application of AI through detection by algorithm called TeleRadTech. So it can improve detection also of the vertebral compression through measurement of the mid diameter of the vertebra. Here we can see there is diminished vertebral height in these two vertebrae. So other application will be composition of the chest CT scan through measurement of the segmentation of the skeletal muscle, as here. We can see segmentation of the pectoralis muscle and posterior or back muscle, and here is the serratus. Because they found there is a link between the skeletal muscle and the lung and pulmonary diseases. Risk for stratification in patient with lung cancer in order to detect the patient outcome. The main issue is the burden for AI is the workflow. So it will help to mark the cases of emergency. So it will make it priority for radiologist to report. As we see this case with pneumothorax, we can see the machine will make it a high priority. And here we can see the pneumothorax easily after application of AI. So it will help to stratify cases according to priority. Here we can see a case of pulmonary nodule after detection of AI, again with AI. Okay, reduction of dose is very important by AI. So this is how it can be done. It can be done through automation, optimization of data acquisition, which is found by other colleagues who highlighted the use of low dose CT. It was equal to the regular dose CT when be applied correctly. Potential uses in AI. The future of AI in thoracic imaging is to filter cases of normal chest X-ray from abnormal chest X-ray. This will monitor to reduce the reading error and make a report. It can be revised by a radiologist. This is the after all of this. AI should be aimed to optimize our performance. As we said in chest X-ray and CT, the challenge in MRI because of the contrast to noise ratio, as well as the spatial and temporal resolution. AI compressed sensing is an developed MRI acceleration to improve the application of AI without sacrification of diagnostic accuracy. Challenge of AI depend on three issues: data diversity, interpretability, and regularity approval by FDA. And the main disadvantage of AI is either to misdiagnose or to overestimate the disease or underestimate the disease. The other limitation is regulatory approval by FDA. Our recommendation is to integrate the AI with tele radiography as well as mobile digital imaging. Our conclusion, it will ultimately reshape the landscape of diagnostic thoracic radiology and the overall performance of radiology department. Thank you.
Thank you دكتورة رانيا for your nice talk. هنخلي الأسئلة في الآخر because we are running out of time.